And Jonath, please introduce yourself as well.
Thanks, Beth. Hi, everyone. I'm Jonath Surgeon. I'm a business analyst at the Children's Hospitals Research Institute. I work for a team called Integrated Research Informatics Services.
Thank you so much, Jonas. So as Beth said, it's already being recorded. But first of all, before we start, we want to acknowledge that we operate on the ancestral and unceded territory of the Coast Salish people, including the territory of the Musqueam, Squamish, Tsleil-Waututh Nation. We recognize their ongoing contribution to the health and well-being of their community. And we also want to express our respect and gratitude for the opportunity to live, work, and serve on this land because of them. It is crucial that we honor and support the right, culture, and history of Indigenous people as we work towards reconciliation and improving healthcare services for all of us here. Now it is my pleasure to finally introduce our 5 amazing speakers. I'm going to give a short bio for everyone, so just bear with me for a couple more minutes. So Rasika Rajapakshe is the senior medical physicist at the BC Cancer and the lead medical physicist for the BC Cancer Breast and Lung Screening Program. He is also a fellow of the Canadian College of Physicists in Medicine, certified in radiation oncology and mammography physics, and certified as healthcare information security and privacy practitioner from ICS2. He initiated the Early Detection AI and Analytics Lab at the BC Cancer Kelowna in 2016, integrating AI and machine learning into clinical setting in oncology, bring them to daily clinical practice while improving the efficiency and rigor of cancer screening, diagnosis, and treatment. Our second speaker is Heidi Longstaff. Heidi Longstaff is a PhD level trained ethicist and a research consultant. She serves as an ethicist on a US-based IRB and is an adjunct professor in the Faculty of Health Sciences at SFU. She has worked as a consultant for Health Canada, the Public Health Agency of Canada, and the CIHR Essex Office. Her work has been published in a variety of journals, including CMAJ, Trends in Neurosciences, and Cell Stem Cell. Our third speaker is Sybila Valdivieso. Sybila Valdivieso is Executive Director and Senior Legal Counsel at our PHSA, where she works with experts in governance, ethics, privacy, analytics, research, and healthcare in support of the health system. Her work during COVID-19 spearheaded an interest in AI, and she's looking at the impact of future regulation of AI in BC. Her background before law was in public economic with a focus of the built, natural, and social environment, including work on gender disparity, environmental health, and housing. She has been called to the bars of Ontario at BC and NBC, and is also a member of the American Bar Association. Our fourth speaker is Heidi Giesbrecht. Heidi Giesbrecht is Senior Executive Director for Strategic Innovation and Portfolio Management with Digital Health Innovation at our PHSA in partnership with BC Ministry of Health. She has dedicated her career to advancing technology that transform healthcare. She's also a strategic leader that guides teams to bridge the gap between innovative technology and enhance the patient outcome by joining her dynamic career in the BC provincial government and public sector. Our last but not least speaker is Jim Bayne. Jim Bayne is a Senior Executive Director, Information Security for PHSA. He's responsible for the delivery of cybersecurity services to regional health organizations in the Lower Mainland and application-specific security services to the Ministry of Health. He co-chairs the Digital Information Security Standing Committee, where he collaborates on information security with regional health authority security leadership to reduce cyber risk across the sector. James has more than 25 years of advanced leadership experience in all aspects of cybersecurity, in both public and private sector. Okay, I think I talked too much already. So without further ado, please just join me in welcoming all our speakers. I'm going to switch to the speaker notes, and then let me see if you can see their screen. Is this all good? Perfect. Okay, I'm going to mute myself from now. You can start, Sybila.
Yeah, perfect. I hope everyone can hear me. So I'm just going to be the first person to speak here with my colleagues. I wanted to make sure I pointed to the disclaimer that we've added to this cover page, that what we're presenting here in many ways are our own views and not necessarily the views of the Provincial Health Services Authority where we work or the views of the Ministry of Health. And that the presentation doesn't provide legal advice. It does share, we are sharing some legal information today, but no legal advice. And so there's no solicitor-client relationship. And could you go to the next slide, please? Thank you. I'm going to be doing a bit of that. We also had a land acknowledgement as presenters today that we think is important to share. So I'm just going to read it briefly. That we wish to acknowledge the Indigenous peoples of all traditional and ancestral lands we work from today. Those of us in Vancouver acknowledge we are on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. While this seminar occurs in a virtual platform, we ask for a moment to recognize the lands, to remember that there are rich Indigenous governances that exist, that are ongoing, and that will go into the future. It's particularly important to recognize this when we gather to discuss legal structures, for the law has traditionally oppressed Indigenous communities. Also, when we discuss legal aspects of privacy and security, we want to be thoughtful about our dialogue about Indigenous concepts of privacy and collective privacy, as well as data sovereignty. We want to make strong efforts to honor the historical and current contributions of Indigenous peoples as part of engaging in meaningful reconciliation. So next slide, please. Thank you. And that is just starting us to talk. I think the first component of our discussion today is going to focus on AI regulation that is impacting health. So if you could go to the next slide. And so given that we're talking about regulation, I think I'm going to start the conversation. We have listed here, and those of you, there may be many of you here today who are already working or looking at these issues. And if you are, you will clearly know that the breadth of considerations is huge for us in healthcare, and that the legal principles are also extremely broad. There is nothing in place right now that regulates AI in British Columbia, but there are other laws that indirectly allow us to control for certain aspects of how, for example, systems are used, etc. So I'm going to, this slide really references what the key pieces of legislation that we're seeing at the moment. The first one that we have listed there is Ontario Bill 194, and that's called the Strengthening Cybersecurity and Building Trust in the Public Sector Act. That piece of legislation was introduced just in May of this year, and it aims to do about 4 different things. It actually will have an impact on existing privacy laws in Ontario. It will create an AI regime in the sense that it's looking at how AI will be developed. Because it's focused on the public sector, it has particular requirements for transparency. So establishing, for example, a risk management approach to how an AI system will be used. It requires certain governance in terms of establishing AI within public sector institutions. And it attempts, and I say attempts because it has just been introduced, and so there's likely to be a lot more discussion, attempts to define an AI system that I think will be the subject of a lot of controversy as we move forward. The other thing it does is that it sets up a regime to protect digital information of minors, which in Ontario is anyone under 18 years of age. And there has been a real strong focus in the privacy advocacy groups across the country and among regulators. There's been a strong focus as we are moving more and more into the digital economy to look at the rights of children, the rights of minors, particularly because there is a tendency to persuade minors through social media. And you may already be aware of a lot of legislation being created to protect the sharing of images, etc. So that's a different conversation, but a little bit related. So you can see where the cybersecurity and building trust is coming into that piece of legislation in Ontario. The second listing there is the Artificial Intelligence and Data Act, which was introduced in 2022 as part of the Digital Act. It's a trifecta of law at the federal level that was introduced in 2022 to basically look at how to manage AI at the federal level, but for trade and commerce. So this piece of legislation still has not been come into force. It has been the subject of a lot of controversy across the country among academics in privacy and security. And also there has been a lot of controversy across academic settings in data environments, health environments, a variety of areas. At the moment, it is in, I think it is in has passed second reading. The other pieces, and we will go back to that when we talk a little bit more about specifics, but we wanted to point out what are the key regulations. The other key policies and directives is the Code of Conduct on the responsible development and management of advanced generative AI systems. You can certainly look this one up and you will see that it was introduced by the federal government basically to provide some guidance while no law has been created. So it's really a way of giving businesses, the private sector, an idea of what it is that they should be looking at, how they should be approaching AI systems, AI technologies in general. The directive, then there's the directive on automated decision-making, which is a directive that was developed at the federal level that applies to government. So again, it's public sector, and it's an excellent guide. If you look it up, it's an excellent guide that provides ideas on tools to use of how to implement many of these concepts into reviews and look at what are the impacts, what is affected, how are people's rights impacted by the use of AI technologies. The last piece we've mentioned there is getting ahead of the curve, which is a report of the privacy and fairness regulators across the country, which gave us a few ideas of kind of the themes, which again, we will discuss in a minute here. So can we move on to the next slide, please? Thanks. This slide provides you with a list of the areas of law that we are seeing in our work are truly impacted by AI and have, in one way or another, a connection inevitably to healthcare, because healthcare is really in everything we do in many ways. So I will quickly go through this because I know it's not fun to be read about legislation, but clearly all federal and provincial privacy laws are impacted by AI. The public sector particularly will have much more demands in terms of the transparency and accountability we have to provide. And in healthcare, the accountability is generally to the public, but also to the patients we serve, and in many ways to our employees, because we hold their data also. Consumer product safety, and Food and Drugs Act. So there's a lot of work being done in Health Canada, and a lot of directives and advice being provided around how we're using products, what are we developing. So medical devices, for example, where AI technology is being used? What are the impacts? These are all areas that are strongly have a strong focus on outcomes and what happens later. What are the abilities for remedy if something goes wrong? Similarly, the Human Rights Act, because of the potential for the impact on fairness. So if there's bias or if the algorithm leads to the wrong outcomes, what happens then? In the criminal code, we listed that here. There is a lot of work being done, particularly in Ontario through the Law Foundation and the Law Commission, looking at the impact of AI through law enforcement. So you may have seen already lots of issues in media about if you use AI for facial recognition issues or other aspects that will have a biased outcome. How do we deal with that in the criminal environment? How do we contain that? For example, the laws that I referenced in the previous slide primarily happen outside the criminal context. So what happens if something goes wrong? What is the connection? Because so much of this is so broad, it really requires us to engage all of society. And so you see that reflected in this listing. I did want to put Bill 64 from Quebec, which is now it's called Law 25, which is really about privacy, but it's an incorporation of AI, and it's really following the European context. So if you're familiar with the GDPR regulation, which is privacy legislation in Europe, this is following that stream. So really providing a very robust and very transparent approach. Quebec functions very differently in Canada when it comes to the law, and this is reflected in that. So again, these are legal regimes pertaining particularly to these areas, but obviously with a lot of impact, the AI will really have an impact in these areas. And we see them in one way or another having a connection to healthcare. For those of you who work very clearly in healthcare, particularly patient side, you will see that all of these have a strong connection. Can you move to the next slide, Sally? Thank you. All right. Here is where I'm going to refer to my colleague Rasika, because I know that he has quite a bit to say about some of these concepts and themes that are coming out of the regulation.
Thank you, Sybila. And can you all hear me? Yeah, okay, yeah. So I kind of wanted to touch base upon some of the sort of practical aspect of these things, particularly, I'm assuming most of you are researchers and are trying to see how these kind of work for you. And one of the things that as a researcher that you want to develop an AI system, as a researchers, we can develop systems and we can test it, but making it clinically available and sustainable is a much more difficult problem. And in this situation, I think it is almost imperative that we will have to collaborate with industrial partners. So they have the sort of know-how or the interest in actually making some money also and continue to make the product available. And I have been in the healthcare industry for a long time. And when I was young, I was naive. I developed systems that, information systems that actually now people are using it. And I realized, well, I have to maintain it. So that's one of the main problems that I will not, I work on research, but I will not work on implementing them because they have to be done by somebody who actually have the capability to go forward and maintain them. Now, when you work on these things, you have to work with sort of a industrial partner. Then you have to share the data with them. There are 3 levels of data sharing that we kind of looked at in our work. First is that maybe a company will come along and say, we want to validate our algorithm. In that case, it's pretty straightforward. We are not providing any information to them. They will give you the algorithm, then you will test it, and then they will see how well it works. So that's pretty straightforward. The next part is they will come along and say, well, we want to fine-tune our algorithm with your data. And that's when it gets a little bit more complex because we don't know how much of the information that is contained in our data they're going to take over. And obviously, I myself don't believe in providing data to third parties. I always believe in keeping the PHSA data within the PHSA systems. And then that's where we have the AWS system set up within the PHSA. We can have external people come in and use our data. And that's okay. And in that case, we originally sort of thought about we will have some sort of a agreement where we will get a discount from the product if we were to use them. And that we realized that purchasing did not like that idea, because when you get to the procurement process, the PHSA wanted to treat every vendor equally. If we give one vendor advantage, then they say, no, the other vendors are going to sue PHSA. So what we sort of agreed in this case is that if we are working with the company, then we will at the very beginning get them to pay us some of the expenses that is required to work on that. In that way, when it comes to the purchasing time, whether that company or other company won't have a particular advantage. And the third part is when a company uses our data to actually apply for FDA approval. And that's where very important for us to think about these things, because our data will be used to prove that this product is working. In that case, you have to be very careful what kind of data we're providing, how good our data, and are there any biases in the data we are using for these things. So those are the kind of more important things that at the practical level, one had to think about when we talk about these regulations. I'll leave it at that point.
Billa, I think
we wanted to.
Yeah, is this the part where maybe I start to offer a little bit more commentary?
Yes.
Great. So for this next section, we'd like to talk a little bit about some of the integration considerations, how we're starting to look at bringing AI technologies into healthcare. And as we had this conversation in preparation for this session, it really occurred to us that what we're striving toward and what we're all striving toward is achieving what we call the quadruple aim, sometimes the quintuple aim. And that's really making care better for people and putting people at the center of our healthcare programs, priorities, services, but at the same time, improving the health outcomes for the population at large. And that's a delicate balance. While we're meeting the needs of an individual, we also need to ensure that we're meeting the needs of the population and advancing population outcomes. We need to do that while we're also managing costs. And similarly, we have a healthcare human resource crisis that we're managing right now and supporting our healthcare providers in having a better work-life balance, better experience, working to their top of scope of practice and really honoring the value of that expertise and supporting our healthcare systems. So these are interesting cross sections of how we need to look at advancing and transforming healthcare jurisdictionally and certainly in BC. And where it gets exciting is that we start to look at, well, how can AI advance on all of those different fronts for us in the delivery of care and transformation of health systems? There's a lot of opportunity in this space. In BC right now, we're starting to look within the context of some of the major areas of strategic transformation that we need to do. And we're seeing that through the work that we're doing in primary care. We also know that hospital services is another critical area of need, making sure that patient flow and people are getting the services they need in a timely way, and that we're moving people away from going straight to the emergency department, but also finding other pathways where we can support people to get that care in a timely way. Sometimes that's through virtual pathways and triage steps. And so you can imagine where there's some opportunity in that space as well. Cancer care is a huge area of focus in the province as well. And we're seeing some really interesting emerging uses of technology, and certainly how AI has propelled that forward in BC in particular, through the great work that happens with the BC cancer teams. So that, among other areas of focus, is where we're looking to increase our efficiencies and improve the safety and delivery of care. I think this is exciting in that at times we've looked at technology and thought that, oh, that's a really high risk way of starting to support people in their healthcare. Healthcare is a very high touch practice, but at the same time, how can we take some of the subjectivity out of it and bring in technologies, tools, and capabilities that actually augment that subjectivity and augment the capabilities and skills of our healthcare providers. We were really interested in how we can develop new diagnostic tools and treatments. I referred to that, but really it's about reducing the risk of human error and doing that in an ethical way that honors that there's a diversity of population and people. And not one size fits all, but at the same time, how do we bring in technologies that can support our population at large while ensuring that we're doing that in an equitable way that recognizes the uniqueness of the populations that we serve, and in many cases have been significantly underserved historically. So this is also, I think, a call to action for us of how can we start to look at these technologies to address some of those underserved populations. Next slide. Just a couple of visuals to kind of prompt the thinking. There's I think this one is quite interesting because, if you start to think about the art of the possible, how can we start to bring in artificial intelligence and some of these new capabilities that we're seeing that's propelling us forward in that clinical planning and workflow. I mentioned about, the challenges that we're seeing with our emergency departments and our health human resourcing, as well as some of the climate crises that we're dealing with. So we need to be very smart at how we're ensuring that patients are getting the services that they need across the province. And sometimes that means making sure that we're moving people to the right care facilities and that we have that information in a timely way to do that planning. And that there's that shared care record so that as providers are supporting patients, that they have a complete picture. But then that's so much information. So how do you distill that down in a really expeditious way so that they can get to the point of care and decision making that's needed? Next slide. Thinking about the bedside, tablets and some of the bedside technologies are already in our hospitals, and we're seeing that with some of the new hospital design as well. That's super exciting. But then you start to think about how can we build upon that and really increase whether it is in an acute setting or it's in a home setting. How do you get some of that timely access to information, and how do you bring it together so that you're making smart decisions around whether you need to deploy some community services to somebody in their home environment, or whether they're at risk and we actually do need to bring them into the acute environment. So those are some other areas that we think are have a lot of opportunity, are interesting, and we know teams right now are looking at that. Next slide, please. This one is really kind of getting at that system planning and that macro flow management that I was referring to, the concept of digital twins. We've got a couple of those already in the province and starting to learn from what is the power and impact of having something that allows us to play with some of the permutations and see what would be the implication for us to add human resources or to move a unit or to bring in a different workflow pattern, and what would that mean overall for the performance of whether it's at a unit, hospital, or at a system level, particularly as we look at things like cybersecurity risk, climate risk, some of those high impact events. We can start to model those events and then understand and start to prepare ourselves so that we actually have some of those systems in place when and if they occur. And we're seeing that increasingly, that the systems need to come together to really support each other when one area of our province or program is pulled down for one reason or another. Next slide, starting to talk, maybe we'll jump one more forward. starting to talk a little bit more around sort of the practical frameworks that we're using as we get really excited about these opportunities and technologies. This gives you a bit of a glimpse into how we're approaching it, that we're really looking to align how we're identifying the opportunities of AI with our organizational priorities, government's priorities, what the population and what we're hearing from the public are also areas of need. So it's bringing the opportunity together with where the priorities are. And then doing that in a way that establishes our guiding principles, so that we're doing that in a responsible way, while also looking jurisdictionally, as Sybila was speaking to, around how is that happening elsewhere, federally and globally, and within our own province, so that as we continue down this path, we are aligning and making sure that these are solutions that are scalable. It's the maturity curve that you'll see in that number 3 area there, around as we build up our acumen on what is AI, how does it work, what are appropriate use cases, how do we optimize. We're on a maturity curve and we're all at different places with it. I want to assume that because you're on this call, you're in the research community, you're probably a little bit more familiar, you have a higher level of awareness of some of the risks and opportunities that we're talking about here. But other areas of our sector that really need to be engaged and be thinking about this, they're at different levels of maturity themselves, whether it's just organizational maturity or business maturity in how we start to incorporate these technologies. So we need to help them in that way as we move forward as well. And then it's really an exercise in prioritization, coming back to what I was saying with quadruple or quintuple aim. We have to be cost effective. And so it's where is the highest value for us to introduce and to experiment. And that's a part of the equation for us as well. I'll just jump over number 5, spoke a little bit about that already. And then number 6 is the roadmap. So that's us getting structured as a sector while creating enough latitude and space for teams to experiment and explore. Next slide. This is, in some respects, just a little bit more deeper insight, looking at it from another lens around how we move through priorities and roadmaps, bringing in governance. But I'll just bring your attention to the very end around scaling and optimization. In some respects, we need to work backwards from that, because we need to be smart around how we're experimenting, what we're experimenting on, because we want to make it broadly available, and we want teams and program areas and clinical partners to adopt these technologies. So we really think about how do we bring them along for the journey and involve so that we're making those smart decisions along the way. Next slide. This is a little bit of the nuts and bolts, kind of how we look at it, aligning privacy, ethics, legal. Really important to us that we bring an Indigenous and equity lens to the work that we're doing here, thinking about how do we support adoption upfront. We're planning for that upfront, and we're building on scalable architecture, being mindful that data is at various different stages of use maturity and how we can use it. And so there's some practicalities around that too. But that feedback arrow that you see, that's probably the most interesting thing, is that it's really important to us within PHSA and partners in the health sector that we're doing the evaluation and we're bringing that back into our upfront experimentation and decision making. Next slide. I'll just give you a quick glimpse into some of the considerations that we think about in terms of maturity. So we look at it stratified across a number of different dimensions. Governance is important. We need to bring our partners along and have the right decision makers that are comfortable with making the decisions on what and when we deploy certain services. Data is critical. You guys know that perfectly well, how valuable and important it is that we make the data available for building out these opportunities, bringing people along, identifying the processes. The technology is awesome, but what does that mean for the processes and the impact to workflow and the impact to the users on the ground? And that's another aspect that we need to think about as we introduce AI into our health sector, and then ensuring that we have those scalable, cost sustainable technologies that are part of that too. Next slide. I think this is probably the last one before I'll stop talking, and getting a little bit at the feasibility criteria. So again, trying to be really practical in where we focus our efforts, and assessing against some feasibility criteria, so that as we invest within our teams in PHSA, that we're putting our efforts to things that we think can create positive, high impact, based on a number of different feasibility criteria, but then how do we also support other teams in that same way too? Okay, I think this is where I'll pass it back to my colleagues for some of the privacy and security impacts.
Can we go to the next slide, Sally? Thank you. So I wanted to, I set up a quote here a little bit for the importance of this piece. We've talked about AI, and we want to be excited about the use of AI because in healthcare, as Heidi was saying, there's so much opportunity, and I think for researchers too, it's a very exciting prospect. And I know in many cases, I'm seeing some of the great comments in the chat, and of course, there is already use of AI in many instances across the health sector, and certainly at PHSA, there is already very important use, which is great. What I'm pointing out here is the impact on privacy, privacy being such an important thing in healthcare because of that trust relationship between the healthcare provider and the patient. And also because of the relationship between trust as a whole in the healthcare and what that does to the interactions more broadly. For all of us working in healthcare, we saw that probably at its clearest way through COVID. And when trust is lost, it has a very, very challenging impact. So this, I just put in a quote here from the Office of the Privacy Commissioner, which I thought was really interesting. It says, you know, the uses of AI are based on individuals' personal information, can have serious consequences for their privacy. AI models have the capability to analyze, infer, and predict aspects of individuals' behavior, interests, and even their emotions in striking ways. AI systems can use such insights to make automated decisions about individuals. Such decisions have a real impact on individuals' lives and raise concerns about how they are reached, as well as issues of fairness, accuracy, bias, and discrimination. So in thinking about that, we gave some thought to what would be the privacy considerations for the use of AI in health. And so here's a list of a few of those things. These are, as we listed at the beginning of the discussion, you know, what we're putting forth of our own thinking. PHSA is in the process working with other partners in healthcare. For example, I know that the Privacy Office at PHSA has been working closely with the Privacy Office at Vancouver Coastal and Providence Health, for example, to think about guidance on AI and things of that nature. So this is not intended to take away from any of that. This is simply adding some thoughts on the work that we are seeing. So some of the listings here, I'm just going to read a little bit, is obtaining patient consent if possible, and if not possible, requiring public disclosure of AI development, purpose, and use. And that speaks to the importance of that transparency and the importance of that transparency in the public sector in particular, because of the accountabilities we hold. And you will see that throughout this listing. I think you'll see the theme. Implementing AI accountability frameworks with independent governance structures. So some of that is already happening at PHSA, we have an amazing team in digital health that is looking at this across the organization and looking around to all the different aspects of who we are. PHSA, as you know, has a unique aspect to it because we have many different identities. We are, you know, if you are at BC Children's Hospital, we are a hospital. And if you're working in procurement, we are a procurer of goods and services. And if you're working in research at BC Cancer, we are a research institution. We have an academic identity. We have many, many different identities that are all important. And so some of these issues for discussion are important ones that require kind of this big consultative process. And so that is part of what is also happening as we speak. So going down the list here, establishing AI risk mitigation requirements and de-identifying data, incorporating AI assessments relative to privacy into existing privacy compliance mechanisms. So we already do privacy reviews. Well, we can add a few additional components to take into account an AI technology when we do that, requiring the creation of safe and secure mechanisms for the transfer of data through regulation. So this would be incredibly important to us. I think it would really provide comfort. It would minimize the work that many of our colleagues working in data governance, working in privacy, working in security have to do each and every time there is a new project. If we had a regulation that required this, wouldn't that be great? I think it would be. Setting a minimum data privacy lifecycle literacy requirement. In other words, setting some kind of a training in place so that everybody has sufficient knowledge that would support data democratization, which is so important to be able to use AI and to be able to have access to data, because access to data is another huge component of making sure that we're using AI in the best way possible. Ensuring laws dealing with health information exist so that health sector privacy issues are properly addressed, and providing adequate funding for teams working in these areas. These are two huge issues of concern. They continue to be of concern today. So that means that we have to go to, you probably all have heard of FIPA, but we have to go to FIPA, which is very good law, very important law, but extremely broad because it's really trying to cover everything in public sector. We need our own law. We need law that speaks to our sector, that speaks to the fact that sharing of information is a key component of what we do in healthcare. The next one is supporting efforts to connect the health sector. So this speaks to what I just said through interoperability and health sector privacy laws. So there are very good news here, I think. Recently, the federal government has introduced a piece of legislation for interoperability so that we can have that connectedness of the health system, and that is so important. It continues to me to be quite ridiculous that a physician in private practice sometimes cannot share information with a hospital in certain circumstances. It doesn't make sense. So our laws need to be updated. And we need laws, sorry, just go back for a moment, that allow patients to access their own health data and healthcare providers and institutions to share it safely and with minimal delay. Okay, you can move on to the next one. I think that's our colleague James.
Yeah, just to talk a little bit about the cyber risks around AI. Sybila mentioned FIPA and the importance of assessments, and FIPA mentions reasonable security, and defining what reasonable security is an evolving, ever evolving definition. So what some of the aspects that guide our definition of that and our understanding of that, I've listed on the screen there. NIST has an AI risk management framework out of the National Cyber Security Center out of the UK, and the Canadian Centre for Cybersecurity have put together guidelines for secure AI system development. Canada Health Infoway has an AI toolkit that is under active development and incorporating some of the cyber risk aspects into that. And industry-wide, we have MITRE has put out an adversarial threat landscape for AI systems. All of these are evolving as we learn more about how we're implementing AI and machine learning into our life and into healthcare and other areas and other industries. If we go to the next slide, please. So there's a definition around this, around machine learning, which is adversarial machine learning. And it's really to describe the exploitation of fundamental vulnerabilities in the components. And when we think of that, it's everything from hardware, software, right up through supply chain and the model itself and how it's developed and built. There's a lot of adversaries and threat actors that are just as excited about AI and machine learning as we are, and they're actively looking at ways to compromise those models and the tools and how they're implemented. And often we implement these tools with an understanding of how they operate, and the threat actors are all about misusing it in ways that they weren't intended or we didn't consider or think about. Comment there about using pre-trained models. It makes things a lot faster, gets us further ahead quicker, but it also enables a variety of attacks because those pre-trained models are publicly available, and they're also publicly available to all of the attackers. We go to the next slide. So a couple definitions there. I won't go through all of them, but this is, again, an evolving space for us. There's a lot of people who have a lot of research around how to abuse systems and how it gets applied into various industries. A couple example pictures there. Self-driving vehicle follows the line markings in the road, but if there's an errant marking or a deceptive marking of some sort placed, then you could redirect that self-driving car into oncoming traffic. We've seen examples already with some of the electric vehicles with AI built in that misread semis crossing a road or buses and things like that. Some researchers discovered that as these AI machines are detecting objects like a stop sign, if you put a particular pattern on the stop sign, it turns it to a green light or a 40-kilometer-an-hour sign. So how can that be applied in kind of the real environment? Hopefully people don't do that, but it's something to consider. And a number of researchers with object recognition of people and individuals came up with a sweater that they could put on and makes them invisible to the machine learning detection capabilities. So there are other examples in all of the attack categories, but I think the point is that in many cases we may not consider how our models can be abused, and how, whether that's nation states that are trying to gain a competitive advantage over Canada and the great research we're doing, may be very interested in stealing or acquiring or undermining the systems that we put in place. If we go to the next slide. So how do we reduce that cyber risk? Have awareness of how your system could be misused, test them, and apply mitigations. Use the guides that are coming out and available. Consider the sensitivity and types of data used that may influence its value to an attacker. As I said, it's very competitive out there. There are nation states, there are other clinical trials going on, that maybe there's a motivation somewhere. It's not always nation state focused. And consider that supply chain, right? So if where it's not internally developed, you're acquiring externally, then make sure that what you're acquiring is well secured, it's well documented. If there's open source models or components that you're using, make sure that they are well maintained. And also consider that malicious adversaries can also publish free trained models to GitHub as well. So the trust that you have in how you're building your systems needs to be considered. And protect your model continuously. How do you implement or how do you explain trust, and how do you give confidence and trust in the systems that you're providing or the models that you're providing others? And ensure that your systems are always up to date. Some of these attacks are still valid today, as they were 5-10 years ago. Keep your systems up to date and apply software fixes and maintain your systems. And next slide. I'll pass it back to Sybila.
Yeah, I think that concludes our presentation. Thank you, James. And we just wanted to put up that question, which we all of our colleagues, including our colleague Holly Longstaff, who one of the comments she had made to us, she said, "Oh, I don't need to say anything. I'm just going to be there." And we said, "Well, no, we want you there because in actual fact, the ethics component of AI in Canada has been strongly developed. So there's been a lot of ethics that has really framed some of the discussions and the key regulations and the different codes of conduct. So that's partly why but she is definitely included." And so, but the last question we wanted to bring to you was, what do we want? And we were thinking, what do we want from this? And we want the use of AI in health to provide outcomes that maximize benefits and minimize risks. And we want to, as another one of our colleagues here, Heidi said, continue the dialogue, pressing forward, helping to build the AI acumen for our health sector partners, for us, for our teams, our colleagues, and government, so that we can thoughtfully experiment with an eye to solving many challenges of the day, whether they're human resources, an aging population, diversity, inclusivity, and serving the underserved. So thank you.
Thank you so much, Sabina. I think we have a lot of amazing questions in the chat box. So while I switch to our Q&A slides, I'm gonna let Bas and Jonas to introduce the questions we have received.
Thanks. I'll pass it over to Jonas. Because we're running out of time before we go, I just want to remind everyone that the conversation will continue next week. So if we don't get to everything, don't worry. And also I put in the chat a contact information for our PHSA AI and Research Working Group. If you want to follow up, you can reach out to us there and we'll connect you to the right people as well. But Jonas, go ahead.
Mm-hmm. And I'm also keeping a note of all the questions. So if you don't get through them, in this session, we'll get through that later. And thanks once again for the speakers, for taking the time to prepare these slides and being here today to present it. It was a really informative session. We're going to go through a few questions from the audience and maybe end it off with a question I have. So the first question we had from the audience was, how can we be more proactive with the legislation or best practices, security and privacies in the context of new technologies? And it seems like we tend to be a little bit more reactive. And not sure if this is because of some of these systems and are based on the precedents.
Yeah, James, do you want to share that response with me if you like? Because it's both privacy and security, but I We do have, for example, existing policies. We have the key issue here is AI isn't, there isn't any law in place specifically about AI. And so it has really come upon us to come together and figure out a way of building something that makes sense for the organization. And in an organization of the breadth of work that we do, one area alone can't really be the one to make the determination. So one of the ways that we're trying to address this is there are conversations at PHSA basically across key areas, looking at the best way to implement an approach. Where we have dealt with AI, because we do have existing AI usage, is in my department where I work in legal, for example, when AI solutions are being contracted with, those contracts are being reviewed and we're assessing them from a legal risk perspective. I'm also aware that in our procurement space that it's being looked at. And so those kinds of risks are addressed through that piece, but there's more that needs to be done, quite a bit more. I don't know, James, if you want to add something there.
No, I think that, for the most part, what was yesterday still applies today, fundamentally, but it is an evolving space for us, and I think we need to maintain the just that agility and flexibility in what we're doing.
Thanks for that. I'm gonna go to one of the most liked comments. Are there working groups at other health authorities that have navigated these regulations to implement AI aided process in clinical or operational workflows?
So I can speak a little bit about that. There are no regulations in place. So the laws that I was referencing when the conversation began was to basically explain that there are some laws that are addressing AI at the federal level that are still being, they have not come into force. So they're not law yet, they're proposed laws. Similarly in Ontario. In BC, there is nothing at the moment. So what happens is other areas of law have components where we can deal with some of these issues. So one of the ways is through privacy law, for example, and contract law, sometimes intellectual property, and then the range of different legal regimes that I was referencing in that beginning are areas of impact. And some of this is being developed also by Health Canada, for example, in the cases of food and drugs for medical devices or consumer protections. There are lots of conversations, but law itself pertaining to AI is still not with us. That has been a bit strategic. So Canada is a leader in AI development, and many of you in research may know that. So, the MILA, the advisors, like key institutes in Canada have been the developers of AI, really important in that innovation space. And so for a while, my understanding is the government took a position that was a little bit like balancing innovation with that societal concern. And so other people's beliefs are that government has taken too long to legislate. So you can see that this is a very big conversation, but I hope that provides some assistance there.
Mm-hmm. And I know we are on time. The speakers will be here for a little bit longer to just go through a little bit more question.
Jonas, I'm just going to jump in for a second because I think the clarification on that last question, they're asking not about the regulations themselves, but given the lack of regulations, are we paying attention to and monitoring what's happening across all the health authorities to try to learn from one another across BC, because we're all working in the same space?
Yeah.
Or can you speak to that effort from the
Are
patient?
you thinking about the effort in privacy or what specifically?
No, the effort of, you've talked about how we're using AI already in the health system.
Yes.
There
Yes.
are examples. So how is PHSA keeping track of what's happening to learn from how people are deploying these tools in a way that maintains the, despite the lack of regulations, how are we paying attention to and watching what's happening at the health authorities to learn from one another, I think is more
Yeah. Oh, I see. Okay. So I'm not sure that I would be able to answer that,
maybe
right?
that's for
Because
Heidi.
I know in privacy we're having conversations for sure. I believe in information security we're having, so the areas of work that we do, those are conversations that are being had. I guess to the extent that we can go in and, confirm what organizations are doing, that's a bit more difficult because we are all separate and distinct. So, but I think that there's definitely an interest and an important interest in coming together.
Sybila, you said it very nicely, and perhaps that's something that we could follow on in next week's talk, is a little bit more insights into sort of how we're envisioning some of the coordinated efforts. But that's evolving, as you say, there's definitely an interest, and a lot of connections are being made, but how we can embrace and support that to build that learning environment for our teams, that is part of the task at hand for us right now.
Yeah.
We have another interesting question from the audience. How are we incorporating Indigenous and reconciliation-centered approach in the AI work we do? And will there be any involvement or consultation from the Indigenous health or First Nation groups and communities? And what does it look like at BHSA?
Yeah, so I can speak directly to that because that's part of the office out. So I oversee the privacy area, and we're certainly having conversations about that with Indigenous health and looking into the privacy component and the issues that arise in that space. And certainly when AI is being used, we're also looking at that more broadly. So the conversation that PHSA is engaged in right now at the leadership level engages Indigenous health and is bringing those concepts to how an organization-wide approach will be developed. So that's definitely on site. But we're a very big organization with lots of different activity, right? So you have to remember that we have a clinical environment, but PHSA's environment is all specialty care. So sometimes the kind of care that we're providing in one setting is quite distinct from another setting. And so all of that has to be taken into consideration. So just one example alone is the delivery of mental health. We are involved in forensics, which is quite unique. And so all of that needs discussion and needs consideration. Similarly, in the digital space that Heidi works in the ethics space, all that is important, but we want inclusivity of perspectives as well.
Okay, we are 5 minutes past 1. I think we could stop here. There are a lot of really good questions out there. We'll continue this conversation next Thursday. Sally, I'll pass it on to Sally.
Thank you so much. Just be mindful of time. I know, a lot of you have to go for another meeting. So we will continue the conversation next Thursday for the audience who are still with us. So don't feel scared if your questions are not answered. We did copy and paste all your questions, and Jonas or Bas will help you next time. So thank you. See you next time. Bye.